Good morning, this is Dan Carter from the Norse Free from Pain Clinic and Norse Fitness and Rehab Centre. I want to take this moment to talk to you about lifting and lower back pain, okay? So, lower back pain, as we know, is really common. And some people suffer terribly throughout their lives, on and off, seeing the therapist at various times and still don't get a result. So what I want to just give you is a few tips on lifting and try and ease the pressure on that back. So here's the example, right? All of us do this. We're picking stuff off the floor, loading our dishwasher, whatever it may well be. And we go down to do it and we round our back, okay? And what's happening is that tissue on our back is elongating as we go. And if we're talking discs, okay, or vertebrae, as you bend forward, the space at the back of the disc or the back of the vertebrae is opening up, stretching those ligaments, increasing anterior disc pressure, which potentially could cause, over a long period of time, herniation of the discs out the back. So, what we need to do is we need to teach ourselves to move correctly. Now, the way in which we're going to do that is to understand how the back works. So, the way these large bits of soft tissue work, so we're going to collectively refer to them as the erector spinae for simplicity, is they have an angle of, or a grain if you like, and the grain sort of goes that way, okay? And they're designed so that when you bend forward, they're very good at holding the shear force between our vertebrae, okay? So if we keep this neutral spine and a little bit of curve here, they work really well in this plane at keeping the vertebrae where they should be and reducing the stress. Now the problem is that the moment that we round our back, though instead of the grain going that way, it pulls more towards this way. And therefore, biomechanically, it can't hold the strain between the vertebrae, and it thus causes problems. Okay, so what we have to do is when we are teaching people to lift, we have to start with the so-called hip hinge. So imagine that we've got a big axis right the way through the hip. To cause a little tight, and we've got a little bit of curve in our back. Chin up, chest up, think karate bow. And what we're going to do is we're going to push our bum backwards. And you'll notice that my back position has not changed. And we're going to repeat this position. Now what I often do is I put someone in the corner of the room, step away from the corner of the room, okay, and then I'm going to go move your bum backwards to find the corner of the room, to find the wall. And we practice this, okay? And then what I'll do is I'll throw in a Pilates roll down to contrast. Now Pilates roll down is a really good stretch. It's fantastic for stretching, but it's bad for biomechanical lifting. So this idea of keeping your bum over your heels is not good in terms of lifting, and the rolling each vertebrae down is not good for lifting, okay? And then we roll it back up vertebra at a time. Now I don't have a bad back, but I can feel that straight away. So what I'll get people to do is we'll go hip hinge, move the bum back, legs locked, 1, 2, 3, we'll go through to 10, and then we'll do one roll down to feel the contrast, and back up, and repeat. And that's a really good way to start your retraining of your back. You can do it with people who are not really bad, okay, because if they're really bad, you've got to back off a bit, but as they start to come into that subacute phase, okay, but it's really important for long-term back pain to re-educate yourself on how to lift. Well done, good luck.